Hi, my name is Matt Backhouse. I'm the head of stray animal care in Southeast Asia for PAWS International. Thank you for inviting me to speak today on this ICAM online conference. It's a real pleasure to be back and to be sharing space with some amazing speakers over a range of interesting and important topics in our area of work. So today, I'm going to be talking about some barriers to reaching the 0 by 30 rabies target in Southeast Asia. So some of the main things I'm going to be talking about, some of the scientific, political, and economic perspectives as to why this might not be achievable. First thing, I'm going to explain what I mean when I talk about 0 by 30. I'm going to look then at the impact that COVID-19 and the global pandemic had on rabies control efforts, as well as looking at surveillance data, the lack of reporting, especially in vulnerable communities, the role of the dog and cat meat trade, as well as domestic and transboundary disease transmission. And lastly, considering how humane and sustainable dog and cat population management might impact our ability to eliminate rabies in Southeast Asia. So first, let me explain what I mean when I'm talking about the 0 by 30 strategy. This is the global plan that was designed by the World Health Organization, the FAO, the World Organization for Animal Health, or OIE previously, and the Global Alliance for Rabies Control to eliminate dog-mediated human rabies deaths by 2030. So that doesn't mean eliminating rabies entirely through animal populations. It simply means no more human deaths from rabies by the year 2030. Rabies is 100% fatal if left untreated and responsible for almost 60,000 deaths per year, although that number may in actuality be higher, and most of those deaths occur in vulnerable, marginalized communities in different parts of the world. The strategy was designed because rabies elimination requires a multi-stakeholder collaboration under a One Health framework, and I'll talk more about that as the presentation goes on. In 2020, the United Against Rabies Forum, of which PAWS is a member, was launched by FAO, WOA, and WHO, or the tripartite, with the aim of accelerating and implementing this One Health approach, which was agreed in the strategy I've just mentioned. So this is to engage priority rabies endemic countries to support the development and implementation of national strategic plans, to engage local authorities and communities to prioritize rabies, which again, I'm going to talk a little bit more about, facilitate access to human vaccines, and improve and support with surveillance, data sharing, all these other important components I'm going to look at through the course of this presentation. So United Against Rabies is the kind of driving force now, the stakeholder forum, to facilitate the 0 by 30 global strategic plan. As many of you may know, every year on September 28th, we celebrate or we recognize Rabies Day, World Rabies Day. This is driven by the Global Alliance for Rabies Control, GARC. It's a really great initiative to keep shining a light and keep raising attention for rabies issues. And the reason that I wanted to speak about this particular subject today was inspired by the theme of this year's World Rabies Day, which is breaking rabies boundaries. So as you can see here, listed are some of the key components, which I took from the GARC website for the theme for this year. All of these are really important things and part of what I'm going to discuss as I move through this presentation today. So these breaking disease silos, the lack of One Health collaboration, lack of innovation, disease awareness generally, all critical components to aiming towards this 0 by 30 target. So let's have a look now at the impact of COVID-19. So of course, nobody across the world was unaffected by the global pandemic and the devastating effect that had on communities, people all around the world. What's been really interesting is now some study and some papers, such as the ones here that I've highlighted by Nadal and Ruprecht et al., as to how that pandemic impacted canine rabies control efforts. So in the mixed method study from Nadal, there was a number of things that were identified. So budgets were cut and resources were allocated away from rabies into COVID vaccines, into the various things that were needed to respond to that global pandemic. There were practical implications. So mass dog vaccination and DCPM efforts couldn't take place because of lockdowns, restrictions on movement. Surveillance and reporting were affected. There were a lack of ability to report on certain instances, especially of rabies cases, bites, various other things. Vaccine availability was impacted. Most of the vaccine production went towards COVID vaccines for humans. And so the post-exposure prophylaxis, or PEP for short, which is the vaccine somebody would receive after being bitten by a potentially rabid animal. Again, the supply, which is already often quite low in many countries, was even more reduced. Education programs were impacted. Kids weren't going to school. So even some of those that had access to online education, the impact was lessened, and many of those children in rural and lower income communities don't have access to online education. There was a slight increase in some dog populations in certain areas, again, because the population control programs were affected. There was also an increase in abandonment. People were struggling to make ends meet. They were struggling with their own personal situations. Many of them abandoned animals, and many of those were absorbed into the kind of stray and roaming population. And in the paper about the rabies in a post-pandemic world, it was recognized that progress has suffered, technological progress has suffered for rabies control measures. We still have vast socioeconomic disparities, and there is still evidence of a lack of global political will, sufficient investment into rabies as a priority, neglected tropical disease. So surveillance data has long been a problem with rabies control efforts. This is a very kind of deep and complex topic, so I'm just going to cover generally here for this short presentation. This paper here is really excellent, and it goes into detail about, the title says, the woeful state of global rabies data and the impact that this has on the 2030 Sustainable Development Goals, as well as the 0 by 30 target. So what's recognized here is that there is limited capacity in many countries, limited resources, limited knowledge and skills into how to collect data. What we're talking about here is many multiple streams of data, from rabies bite cases, integrated bite case management, population densities, population numbers. There is a whole range of information, and it needs to be consolidated and recorded correctly and in an efficient way to be able to design the best and impactful and appropriate interventions. Again, this is where the United Against Rabies Forum and GARC are excellent, because they have toolkits which is consolidating all of the best practice information into an easy to use toolbox or repository. But again, knowing how to use those tools and implementing them and having the resources to do that is one of the challenges that is faced most commonly, especially here in Southeast Asia. Lack of reporting is also another big problem. Many, as I mentioned in the introduction, many people in poor and rural communities are the ones most affected, often being bitten, often not having access to the information about what to do if they have been bitten, or if they think they've been exposed to an animal that's at risk. The access to the vaccines, even if they do know what to do, can they get to the healthcare services that they need? Can they access these vaccines that they need? Can they access vaccines for their animals? And lack of funds. Many people, even if they can get to these services, often they can't afford to pay for them. So again, there is a huge range of issues that affect the most vulnerable in a range of different societies and social groups, from being safe and protected, both the animals and the humans in those communities. One excellent development, though, and I've linked here this kind of screenshot from a bulletin from the WHO, which came out on the 7th of June. Gavi, which is the Global Vaccine Alliance, has pledged to include rabies vaccine access in its strategy for 2021 to 2025. There has been some deferred implementation of this strategy due to the COVID pandemic, but it's now resumed, and hopefully this will now allow countries the opportunity to apply for vaccines from this Vaccine Alliance and Vaccine Bank, and to be able to provide access to care where it's needed. It's again a really good step forward, but bearing in mind there is still a huge amount to do in the next 6 years, between now and 2030. So again, just to highlight some cases from Vietnam. So Vietnam has had an uptick. There's actually been double the amount of deaths from rabies this year than there were last year. And even though the Department of Health has been trying to implement preventative measures, vaccinations, confinement of dogs, access to information about washing wounds after bites with soap and water and all the things that they should be doing, there has still been an increase in human deaths in over 20 provinces in Vietnam. Again, what's interesting here is to understand that the surveillance data, the reporting, and all the metrics, the monitoring, evaluation that I'm talking about, it's so important, and it's essential to do it correctly. So the image on the right-hand side, as myself, and we were at a World Rabies Day vaccination event in Gia Lai province last year, one of the provinces in Vietnam affected the most severely with rabies outbreaks. The number of vaccines provided to the competent authority who have to go and vaccinate dogs is way below the number of dogs in that community. They just don't have enough vaccines for the number of animals. And those animal numbers are recorded through household surveys. So it's not accounting for a stray and roaming population of animals. So it might not even accurately reflect the total number of animals in that population. So again, the surveillance, the data, the monitoring, it's all critical. And then having the resource and the supply, once you know the numbers, to be able to implement an effective program. So last year I spoke at length on the dog and cat meat trade, the implications of rabies control and population management. I'm not going to talk too much about that now. I've linked here the presentation from last year. You can also access all of the other ICAM presentations, which are online, so I recommend you do that. And we have some publications on our website for PAWS about the risk of dog and cat meat and the global health risk, especially when it comes to rabies. A couple of the key points just to point out, though, is that the dog and cat meat trade needs to be recognised by governments where it exists for its critical and influential role in rabies control. As you can see here, there are studies cited from Hampson and Ling, which show evidence of rabid animals or rabies positive dogs being found in slaughterhouses, being responsible for rabies outbreak cases, as mentioned here in this 2007 outbreak. There has been study by the Pasteur Institute in Cambodia, where almost 50% of the dogs that were tested there were rabies positive. And Cambodia has a massive dog meat trade. Almost 3 million animals per year are being transported around the country and killed and eaten. So again, rabies is transmitting around the country, as well as putting the slaughterhouse workers and the people catching and killing these animals at risk, and undermining control efforts by removing potentially vaccinated animals from the population. This also connects to one of the other main points, so the domestic and transboundary disease transmission. Here I've just got two images from Vietnam to kind of indicate the scope of the dog and cat meat trade that takes place within the country, as well as domestic transmission. So from the south of Vietnam all the way to the north, you have dogs and cats being transported en masse, caught, transported and killed in another part of the country. But there's evidence to suggest that they are traveling across international borders as well. So this is where ASEAN, which is the Association of Southeast Asian Nations, needs to really look at a connected rabies elimination strategy, and they have done. So there has been an ASEAN strategy. There was also a revision of that strategy, there was a meeting in Indonesia at the end of last year. And so the ASEAN rabies elimination strategy is being reviewed and updated to align with the 0 by 30 global strategy. But again, I would say it's imperative that it needs to be considered as part of the wider picture. So where are these animals going? What are the kind of checks and controls on international borders and the movement of animals domestically as well? So this then leads us to humane and sustainable dog and cat population management. Again, this is an ICAM conference, so this is going to be well talked about in many different ways. Here, though, we want to talk about it in this specific context of rabies control. Often, governments will resort to culling, sheltering, mass sheltering rather, so removing animals from the street and putting them in shelters as a means of rabies control. We know very well that that does not work and is well evidenced and well documented. What's important here is trying to implement humane sustainable DCPM programs as part of the broader narrative and the broader structure for rabies elimination. This was where sometimes, because of the cost, the expense, the difficulty in implementation, can maybe overlooked. And while mass dog vaccination is important, and there are very strong evidences to suggest that mass dog vaccination alone can really get on top of a rabies population. Huge credit to Mission Rabies for their success in this area. Long term, we also need to look at the sustainable population control. There is a great paper as well, which I'll link to, which details this, about the positive impact that population management can have on rabies control. And also one of the strongest things that we have when communicating with governments or national authorities is the WOA Terrestrial Animal Health Code, which came out at the end of last year. And specifically here, this extract that I've put on the slide. So understanding local dog population dynamics and community attitudes is a key element in determining whether and how DPM programs might contribute to rabies control and which tools would be most successful. Again, you can read through this chapter at length. I put the links here in the slide. I know it's also linked on the ICAM website. It's really important to look at all of this in a kind of whole symbiotic connection. And a good example of this is in Bali. So Bali has had problems with rabies for years, and there was actually some real success in 2010, 2011, getting on top of the disease outbreak. Unfortunately, in 2021, there was a resurgence of rabies outbreaks across the island. And then there was a move to kind of reinstate this TESIRA program, which is supporting a bylaw that was created in 2009. The problem with that bylaw from our perspective is that it included a mandate to chain, cage, or eliminate roaming dogs as a means of rabies vaccination control. What we believe, and working with our partner Bali Animal Welfare and working on these various data-driven programs, is that well-managed populations of vaccinated animals are the key to eliminating rabies. And the chaining, caging, confinement, these various other restriction control methods don't necessarily help achieve that aim. So in the context of 0 by 30, where it's important here is looking at all these different projects, looking at all the key stakeholders, talking to everybody, getting the data, the information, the best practice, and designing interventions based on the best knowledge that we have. And this is the way that we can succeed in eliminating rabies and eliminating human deaths from rabies, and eventually, hopefully, the disease itself. So this has been quite a whistle-stop tour of a very complex subject. I would recommend, if you're interested and you want to pursue any further reading, there's some really good resources here. So obviously the 0 by 30 Global Strategic Plan. Then there's a collection of papers here. There's One Health for Dog-Mediated Rabies, as well as a white paper moving towards rabies-free Southeast Asia. All of these excellent resources available online. And of course, the United Against Rabies, Global Alliance for Rabies Control, principal experts in rabies control, and a whole range of amazing resources, as well as a podcast, which has been launched by the podcast Rabies Today, available again through United Against Rabies, speaking about a range of different issues with a range of different people about issues to do with rabies. And I linked here to an episode in Southeast Asia, which you might find interesting. There is talk there of the control measures in Indonesia, the dog meat trade, some great expert input from Lola Weber at HSI, as well as some colleagues in Indonesia and one of our PAWS colleagues as well. So here then are my references for the slides. I appreciate all of the science and the work that is done. It really is incredible, the amount of information that's available. And it makes me optimistic for achieving this 0 by 30 target. But as I hope I've kind of made my case, there is a lot more that still needs to be done. And there really needs to be a concerted effort with governments, with political will, and with the financial priority and support to really invest in these programs. And then hopefully we can achieve the target. So thank you very much for listening. And any questions, I'll be available after the presentation to answer. Thank you.